So, okay, guys, today is April 16th. So, Fast Coder 21's free CPC, SDS, ASC YouTube live session 15 musculoskeletal system coding scenarios. So, as a warm up procedure, we will learn few anatomy related to musculoskeletal system first. So, as all of us know, whenever we go CPC exam or like while live coding also, we need to know the anatomy of any system. But in musculoskeletal system, it is very important compared to all other systems. So if you know good anatomy in musculoskeletal, you can code it properly. So these are just only we will take 2 or 3 minutes to wind up this. So see here, it starts with 20,100 to 29,999. So we have general means these procedures will be performed on all body parts. So here we have anatomy images. So these are very important too in order to code properly. So while coding also, if you don't know, just check your CPT book and try to remember these anatomy parts. So this is very important. So this is frontal view, skull lateral view, thoracic vertebra, lumbar vertebra. So if you are going to write like doing spine procedure, these images are very important. So then lumbar vertebra, lateral view. So if you are going to code spinal procedures, these anatomy things are very important. We have already videos related to spinal procedures related to CPD and PCS. You can watch those free videos. So next, head, as you know, all of us know. So musculoskeletal system divides based on head to toe level. So first starts with head, neck, then back and flank, spine, in abdomen, shoulder, humerus, forearm and wrist, hand and fingers, pelvis and hip joint, femur and knee joint, legs and ankle joint. These are the phalanges, foot and toes, application of cast and strappings, endoscopy and arthroscopy. So no worries. So now we are going to start with our first question of the day. Question 1. 32-year-old male has a mass growing on his left flank for several years. It has finally gotten significantly larger and is beginning to bother him. He is brought to the operating room for definitive excision. An incision was made directly overlying the mass. The mass was down to the subcutaneous tissue, and the surgeon encountered a well encapsulated lipoma approximately 4 centimeters. So this was excised primarily bluntly with a few attachments divided with electrocautery. What CPT and ICD-10 CM codes are reported? Yeah, you have four options here: 21932, 21935, 21931, 21925. So go ahead and check this one. So now it is 9:33. We will discuss the answer at 9:37. So basically here you need to find the two codes using CPT as well as ICD-10 CM. So try to find that. So we'll discuss the answer at 9:37. So meanwhile, if you complete your answer, mention in the chat box. So it will provide you with the confidence. So basically this is very easy only. So you don't need that much difficulty to find the answer for this question. Yeah, good Paramila. Keep it up. Yeah, good Manjur. So, but these lipomas are very important in live coding. So you need to have good understanding of excision of lipomas. Lipomas are very common procedures performed in the ambulatory surgery centers. So here we have Mamata and Gaurav Srinath Manjur. Try to write the answer in the chat box. So you don't need to worry about the answer. Just you need to know how to find the answer. So we have only 1 minute now. So yeah, 9:37. We can start learning now. So first we need to find the keywords here. 32-year-old male has a mass growing on his flank. So we will make it as keyword. So location is also important. So it is on left flank. It has finally gotten significantly larger and is beginning to bother him. Okay. He is brought to the operating room for definitive excision. So definitive excision means definitive procedure. So they know the condition initially before this operating room procedure. So an incision was made directly overlying the mass. The mass was down to the subcutaneous tissue. So here this subcutaneous tissue level is very important, and also surgeon encountered a well encapsulated lipoma. So first of all you need to know the lipoma. So lipo means fat, oma means tumor. So basically lipomas are fat tumors. So usually they will occur on the subcutaneous tissues or sometimes muscle level. So here this dimension is also very important, 4 centimeters. This was exercised primarily bluntly with a few attachments divided with electrocautery. What CPT and ICD-10 CM codes are reported. So here our keywords are location of the lipoma left flank, and next one is what level this lipoma is located. So subcutaneous tissue, that is also very important keyword, and this is the lipoma for medical necessity, and one of the most important thing is size of the lipoma here. So it is 4 centimeters. So here in order to deep down this question, you no need to worry about ICD-10. Why means you have all different codes here while in CPT section. So if you find CPT also, you can write the correct answer. So what is first? We will check 21932 first. So lipomas are very important in live codings. See here, excision tumor soft tissue of back or flank subfacial. So as I told you before, if the lipoma at muscular level, we need to code 21932. So as per our question, it is subcutaneous level. So we can eliminate 21932. So we will check 21935. So this is radical resection of tumor soft tissue of back or flank less than 5 centimeters. So this is also wrong. Why means physician is not performing radical resection here in this session. So he is only excising. So 21935 is also wrong. We will check 21925. So biopsy soft tissue of back or flank superficial. Here this is deep. So here physician is not performing the biopsy. Physician is performing the excision. So D also wrong. So our answer here is 21931. We will check. So if you check the indentation here, excision, tumor, soft tissue of back or flank. As per our question, this lipoma at subcutaneous level and its dimension is 4 centimeters. So 21930 for 3 centimeters, 21931 is for 3 centimeters or greater. So we have 4 centimeters, so we need to code 21931 3 centimeters or greater. So based on this, our answer is 21931 D171. So most of the people wrote correct answer. So we will go ahead with another question now. So preoperative diagnosis, left scaphoid fracture. Type of procedure, open reduction and internal fixation of left scaphoid fracture. So you can read this operative report and find the answer here so that we can check how can you find the keywords in CPC exam or while doing live coding. So first, if you don't know anatomy, just find where is the scaphoid bone is located. So if you know that one, you can write easily or you can code easily. So now it is 9:42. We can discuss the answer at 9:46. So Chendu, Mohan and Srinath, try to write the answers. No need to worry about the whether answer is correct or wrong. And Gaurav, you can also try, no problems. So anyone can try, whoever want to try. So first try to find the where is scaphoid bone located. So then, so good Parmila, you are doing good job. No worry, surely you will crack your CPC exam. So but just to try to compare the question with the description. Sometimes we can't do that. Just you need to become as a Forsnick auditor while writing the CPC exam. We need to analyze each and every topic. Hi seatmate, good evening. Good evening to Fast Coder 21. You are doing good. So keep it up, seatmate. Good, good. So we have 1 more minute. After that, we can discuss this answer. Okay, Golda, good evening. Good evening, Datta. So thanks for visiting Fast Coder 21 live. So anyway, time is over now. So we can start discussion. So we need to find here keywords is left. So in musculoskeletal procedure, laterality is very important. While coding, live coding or CPC, laterality is very important. You need to concentrate more on lateralities. So in musculoskeletal, it is very important. Laterality is one of the critical point you need to remember. So basically it is a scaphoid fracture. So basically these scaphoid fractures will occur in the wrist area. So scaphoid fracture is a break in one of the small bones, carpal bones of the wrist. So we got to know that scaphoid fracture is related to the carpal bones of wrist. So what is the procedure? Open reduction and internal fixation of left scaphoid fracture. So basically it is very common procedure for fractures. Usually we'll call it as ORIF. Open reduction and internal fixation. So we'll find the keywords now here. So the patient was brought to the operating room, anesthesia having been administered. So you need to find the keyword here also in the operative report. So what happens sometimes? So physician will write type of procedure, he will write right, but in the operative report they will mention left. So in that situation, you need to go ahead with the description of the procedure, not with the heading of the procedure. So you need to consider it as left upper extremity, not right upper extremity based on the type of procedure. So always you need to concentrate more on the description of the procedure. So here we got one keyword so that it is left upper extremity was prepped and draped in the sterile manner. The limb was elevated, exsanguinated and pneumatic arm tourniquet was elevated. So from here we need to find properly. So an incision was made over the dorsal radial aspect of the left wrist. So here also mention left wrist. Then skin flaps were elevated, cutaneous nerve branches were identified and very gently retracted. The interval between the second and third dorsal compartment tendons was identified and entered. The respective tendons were retracted. A dorsal capsulotomy incision was made. So this is also one of the keyword in musculoskeletal system, and you can find this capsulotomy in breast procedures also. So basically capsulotomy means so our joints are surrounded by capsule. So capsulotomy means incision on the capsule. So and the fracture was visualized. So as soon as the physician has made capsulotomy, he can see the fracture here. So there did not appear to be any type of significant defect at the fracture site. So there is no problem at the fracture site. A 0.045 Kirschner wire was then used as a guide wire extending from the proximal fold of the scaphoid distal ward. The guide wire was positioned appropriately and then measured. A 25 mm AccuTrack drill bit was drilled to 25 mm. A 22.5 mm screw was selected and inserted and rigid internal fixation was accompanied in this fashion. So here one more keyword is Kirschner wire. Usually ORF procedures, physician will use wires and they will stabilize the fracture. And one more keyword here is internal fixation was accomplished in this fashion. This was visualized under the OAC meaning device in multiple projections. So this is normal only. So we will check. So here based on these keywords, our laterality is left upper extremity. So here physician has used wire in order to fix the fracture. So here physician has performed internal fixation. So we will check 25624. Yeah, this is 25624 is closure treatment. If you see here, closure treatment of carpal scaphoid fracture with manipulation. But as per our question, ours is open fracture. So 25624 is wrong. So we will check 25645. So open treatment of carpal bone fracture, each bone. So here it is open treatment only, but there is no internal fixation. So even 25645 is also wrong. So we are left with 25651. So this is percutaneous skeletal fixation of ulnar styloid fracture. What happens here? Physician will not make any incision in percutaneous skeletal fixation using the fluoroscopy or ultrasound guidance. Directly he will insert the screw or wires inside the joint in order to stabilize. So because of this, this is also wrong. Physician performed open reduction, not percutaneous procedure. And we are left with 25628. We will check that. So 25628, open treatment of carpal scaphoid, usually we'll call it as navicular fracture, includes internal fixation when performed. So because of all these rationale, our answer is 25628. Open treatment of carpal scaphoid fracture includes internal fixation when performed. So based on our keywords, here our answer is 25628 left. So I most of the people wrote correct only, no worries. So next one, an infant with genovalgum is brought to the operating room to have bilateral medial distal femur hemi-epiphysiodesis done. On each knee, the CM was used to localize the growth plate. Opened. The periosteum was not opened. The arthrophyx figure of 8 plate was placed and checked with X-ray. We then irrigated and closed the medial fascia with 0 vicryl suture. The skin was closed with 2O vicryl and 3O monocryl. What procedure code is reported? So we have four options: 27470, 7577 and 85. So now it is 952. We will discuss the answer at 956. So as I told you before, try to find the condition also. It is good in order to stay in the medical coding. You need to know the condition as well as the its remedies. So try to find what is genu valgum. Then find your keywords. Yeah, good Parmila. You are doing good. So it is very easy only. So, Ojam Bhima Reddy, good evening. Deepin, good evening. So, basically, so you want WhatsApp group. So, after completion of this session, I will give you so that meanwhile people are joining during we are live. So, if I give it after completion of this session, anyone can join or everyone can join. So, now time over. So, basically, so third question, an infant with genovalgum. So what is genovalgum here? So we need to make it as a keyword. So genovalgum is the condition where knees come together and ankles go apart. So an infant with genovalgum is brought to the operating room to have bilateral medial distal femur hemi-epiphysiodesis. So here you need to remember the guideline that in musculoskeletal, so laterality plays very important role. So you need to find the keyword for laterality also. Hemi-epiphysiodesis. So physiodesis means it is fusion procedure. Here physician is performing hemi-epiphysiodesis. So he is fusing the epiphysis. So on each knee the seam was. So see here physician is performing the procedure on two knees. So here he mentioned on each knee. The seam was used to localize the growth plate. So with the growth plate localized, an incision was made medially on both sides. So this is also one keyword. This was taken down to the fascia which was opened, the periosteum. So what is periosteum? Osteum means bone, peri means surrounding the bone. So periosteum means surrounding the bone was not opened. So the orthofix figure of 8 plate was placed and checked with X-ray. We then irrigated and closed the medial fascia with ovacral suture. The skin was closed with 2 ovacral and 3 monocral. What procedure code is reported? So for this, most of the people wrote correct answer only. So our answer here is 27485. We will check directly that. So as most of the people wrote the correct answer, we no need to worry about this one. 27485 directly. So otherwise we can check 27470. What is that? All are side by side only, no worries. So 70, repair non-union or malunion femur distal to head and neck. So even our location is also wrong. Here physician is performed hemi-epiphysiodesis, not repair. So 27470 is wrong. What is next? 27475. What is this? Arrest epiphyseal any method. So this is also wrong. He did not arrest anything. Here distal femur. So here it is related to femur procedure. So this is also wrong. Next 27477. So this is arrest epiphyseal any method, tibia and fibula proximal. So here physician is performing the procedure at knee level, not and tibia fibula. And what is next? 27485. So here arrest hemiphyseal. So here our keyword is, if you see in the documentation, hemiphysiodesis. So in our CPT code also we have hemiphysial distal femur or proximal tibia or fibula. So here this procedure is performed for genovarus or valgus. So as I told you before in the previous sessions, based on ICD or condition also you can find the CPT procedure. So if anytime if you are confused with the procedure, you can check with the condition also. In this situation, genovalgum, it is a condition basically, but you can find, if you find geno also you can find this answer. So need to understand this, using the condition also you can find the answer here. So anyway, most of the people wrote correct answer here. So best of luck guys if you are going to write CPC exam. Hi Asin, good evening. Hi Vishwanath. Yeah, based on this, our answer is D, 27485. So in musculoskeletal system, laterality and location of the condition is very important. So if you don't know while writing in CPC, you need to find the anatomy images and find the answer. If you are doing live coding, you can you can check online. So only anatomy image is enough for you. Just check the anatomy image and find the correct answer. So personally, I love musculoskeletal system more compared to all. So thank you, Vishnath. Thanks for attending this session. This session might be very useful for you. So question number 4, 62-year-old female has frozen right shoulder and arthroscope was inserted in the posterior portal in the glenohumeral joint. So guys, just you can read this question and find the answer. So you can get practice while writing the CPC also. So afterwards I will read. So question number 4, just read this question and write the answer. So after getting answer, while we are discussing, I will read once again. Hi Raju, good evening. Raju, good evening. So already we have nearly 15 videos related to E&M coding. You can watch those sessions. If you want, I will provide the link here. If you don't understand using those sessions, please comment. We will make other videos. So now 10.3, we will discuss the answer at 10.6. Raju, I have posted one playlist here, YouTube playlist. You have 13 videos related to evaluation management using 2023 guidelines. So watch those guidelines. Watch those guidelines, and if you don't understand, just please let me know. I will try to make few other videos in order to explain easily. So we have one more minute. So there we have explained what is 2 by 3 and 3 by 3. So you can watch. So time over guys, now we can discuss the answer now. So 62-year-old female has frozen right shoulder. So what happens to the patient? So frozen right shoulder. So this is the keyword. So based on this procedure, we need to understand whether it is open procedure or arthroscopic procedure. So based on the procedure description, it is a arthroscopic procedure. If you see here, this arthroscopy is mentioned in the document. So it is a arthroscopic procedure. So it is also very important while coding musculoskeletal system. You need to identify whether it is open procedure, percutaneous procedure, arthroscopic procedure, or closure procedure. So these four types of Chinna, we will check all these things later. First, we will finish our session. So all these four key points you need to remember whether procedure is open procedure, otherwise closed procedure, percutaneous procedure, or arthroscopic procedure. So as soon as you see the question, you need to understand what is the procedure physician has performed. So we have seen previously. So based on closed open procedure, we have the code. So we need to identify the approach to the procedure first. So here physician has used arthroscopy. So arthroscope was inserted in the posterior portal. So one of the keyword for this arthroscopy is portal. So this is the more very important keywords. If you find portal, so if you can't find arthroscope also, you can directly code arthroscopy coding. So portal in the glenohumeral joint. So glenohumeral means it is a shoulder joint. So glenoid as well as the humerus. It is the joint between glenoid labrum and humerus. So the articular cartilage was normal except for some minimal grade 3 to 4 changes. About 5% of the humerus just adjacent to that rotator cuff insertion of the sub supraspinatus. So these are the muscles which helps the shoulder to provide strength. So the biceps was inflamed, not torn at all. So the superior labrum was not torn at all. The labrum was completely intact. The rotator cuff was completely intact and interior portal was established high in the rotator interval. The rotator interval was very thick and contracted. Adhesions were destroyed with electrocautery and the bovie. So adhesions were destroyed. This is also very important here. So basically what happens here? So whenever the physician examines the joint, he will mention all the observation in the operative report. So all these lines are his observations. What is going on actually inside the shoulder. So see, intact means there is no problem. So these are good. There is no tear here. So it is mandatory for them to mention his observation in the operative report. So our original procedure starts from here. So adhesions were destroyed with electrocautery and the bovie. The superior glenohumeral ligament, the middle glenohumeral ligament, and the tendinous portion of the subscapularis were released. The arthroscope was placed anteriorly. Adhesions were destroyed, and the shaver was used to debride some of the posterior capsule. And the posterior capsule was released in its posterior superior and then posterior inferior aspect. So as we discussed previously, every joint is having the capsule. So here physician and what happened here debrided the capsule. So you need to remember that every joint is having the capsule. So it is the covering of the joint actually. So we will check the answer. So meanwhile you can try yourself, not a problem. So basically, one second, system is not responding. So yeah, now it's fine. So we will check 23450. So basically what happens here? So physician has performed adhesiolysis. So adhesions are destroyed means lysis of adhesions. So he destroyed the adhesions. So only that one physician has performed. We will check 23450. So capsulorrhaphy anterior putti flat procedure. So this is completely wrong. So here physician has performed capsulorrhaphy. Rhaphy means repair. Capsule means capsule. So capsulorrhaphy means repair of the capsule. So next, what is the code? 23466. So here physician did not perform the repair of the capsule. He did perform the adhesiolysis. So 6 is capsulorrhaphy. So this is also wrong. Physician did not perform any capsulorrhaphy here. 29805. So anyway, more than that, those are open procedures, not arthroscopic procedure. So directly we can eliminate through 2 3 series codes like 23450, 23466. Here we are discussing in order to help you guys. So while writing the CPC exam, directly you can eliminate 2340, 2346, as these are the procedure which are performed using open procedure or any other type of procedure. But based on our question, it is arthroscopic procedure. So you need to concentrate more on C and D, 29805, 29825. So we will check 29805 now. So arthroscopy, shoulder, diagnostic with or without synovial biopsy. So this is also wrong. Here physician did not do any synovial biopsy. More than that, it is a separate procedure. We can't code this with more complicated procedure. So we will check 29825 now. So he see here, what is this? Oh, so arthroscopy, shoulder, surgical, and with lysis and resection of adhesions with or without manipulation. See here lysis and resection of adhesions. Usually we will call it as adhesiolysis. So you can keep adhesions first, then lysis. So it completes adhesiolysis. So sometimes you may find the keyword here. Instead of adhesions were destroyed, you may find the keyword like adhesiolysis was performed by the physician using electrocautery and the Bowie. So anyway, most of the people write correct only. So we will cross this one. So our answer is D29825. So you can check the question number 5 and write the answer now. So now time is 10:15. We will discuss the answer at 10:20. So as it is a spinal procedure, bit complicated, but you guys can write easily. So Raju, we have nearly 15 videos related to CPC and CPT. You can watch those videos. If you want, I will provide the link here. So yesterday we have integumentary system coding. You can watch that session. You can find the answer for your question. So if you want, I will provide the link here. Yesterday we have learned most surgery coding. So no worries. You can watch this session. You can find or you can clear your doubt. So this is the link. You can watch that link. If you don't understand, you can mention in the comment section. I will try to explain one more time. No problems. So basically in fast quarter 21, so you can get all types of medical coding videos, including interventional radiology, anesthesia coding, denial coding, HCC coding, inpatient coding, so CPT coding. So whatever you want, you can get. No worries. So these are the most common specialties. So everyone can learn freely. So we have one video, Chinna. So I will post here. You can watch that video. You can clear all your doubts. So Chinna, watch that video. So you can clear all your doubts. If you have any doubts after that also, please mention in the comment section. So you have one more minute. So I did not receive any answer. So Parimala, are you here? Are you with us? Yasin. So yesterday Yasin told she passed CPC exam. So if anyone needs guidance, she can help you. Manzoor, Gaurav, Mamta. So write any answer, no problem with the answer. So whatever you know, that is better. Anyway, you are doing or you are rocking Parmila, no worries, surely will pass. So the students who have attended this session, most of the people are passing. So this week we are two people are going to write the exam. Let us wait for their result. So now time over. Paramila, what you wrote is correct answer. So what happened here? After adequate anesthesia was obtained, the patient was turned prone. So here prone is the very important keyword in spinal procedures, in a kneeling position on the spinal table. A lower midline lumbar incision. So we need to check the spine location also, whether physician is performing surgery at lumbar region or thoracic region or cervical region. So here lumbar region was made and the soft tissues divided down to the spinous process. The soft tissues were stripped away from the lamina down to the facets and discectomies, and laminectomies were then carried out at L3 to 4, L4 to 5 and L5 to S1. So these are also very important. Discectomy means removal of disc. Laminectomy means removal of lamina. So this complete line is very important for us in order to code spinal procedure. So why means using these levels we can find the how many levels physician has performed the surgery. So interbody fusions were set up for those lower three levels using the Danic allografts and augmented with structural autogenous bone from the iliac crest. So these are interbody fusions. So basically all these lines are very important keywords in order to code spinal procedures. The posterior instrumentation, yeah, this is also very important. Diameter tighten a rod was then cut to the appropriate length and bent to confirm the normal lordotic curve. It was then slid immediately onto the bone screws, and at each level compression was carried out as each of the two bolts were tightened so that interbody fusions would be snug, tight as possible. So basically when we narrow down these questions, so patient is placed on the prone position. So it is a posterior procedure. So we can eliminate directly B and D. So we are left with A and C. We will check 22612 first, then we will check 22630. What is 22612? So because the physician has performed procedure on the back using the prone position, we can eliminate B and D. We are left with A and C. Now we are checking A and C. Arthrodesis posterior or posterolateral technique, single interface, cervical below C2. So it is for single interface. See here, do not report 22612 in conjunction with 22630 for the same interface. Use 22633. We will check 22630. So arthrodesis, posterior interbody technique including laminectomy and discectomy to prepare interface space single interface. So basically if we find if you read our operate report, we have keywords like laminectomy and discectomy. So in code description also we have these keywords. So here our answer is 22630. 630 for single interface. If you see here, do not report 6630 in conjunction with 22612 for the same interface and segment. So we have, based on our question, we have three spaces like three levels. So for each level we need to code 22632 add on code. Each additional interface means we have total three interspaces. First interface we will code 22630. For second and third interspace we will code 22632 into times 2. So 2 times we need to code. So based on the client requirement, you may code 22632, 22632 also. It is basically client requirement. But in CPC exam directly you can code 22632 into 2. So because of this, our answer is C here. So Parimala, you are rocking here. You are learning good. No worries. So here you have sixth question. You can read this and find the answer. So try to find the keywords first. If you find the keywords, you can write it very easily. So meanwhile, if you forgot to click on like button, click it now. So it will motivate me and provide more useful sessions like this. So it is very easy, only using the diagnosis also you can find the answer for this. So now we have 1 more minute. Yeah, now we can discuss the answer. So here what happens? Displaced impacted Colles fracture. So I think you can find this answer using keyword Colles also. We will check that. See here, using Colles also you can find the answer here. So what happened here in our question? Left distal radius and ulna. So post-op also same, displaced impacted Colles fracture, left distal radius and ulna. So reduction with application of external fixation system, left wrist fracture. So basically here physician is uh, manipulating or performing the reduction and applied external fixation system. So here physician will not open the fracture site. We will check that. Findings: the patient is a 25-year-old right hand dominant female who fell off stage 4 to 5 days ago, sustaining an impacted distal radius fracture. So these are the very important keywords. What site of the fracture is, sorry, bone is damaged here. So as all of us know, we have proximal and distal. So here it is distal radius fracture with possible intra-articular component and an associated ulnar styloid fracture. So intra-articular means this fracture may leads to intra-articular inside the joint also, but that is not confirmed here as it is mentioned possible. So today in surgery, fracture was reduced anatomically and an external fixation system was applied. So here manually physician has reduced the fracture and applied the fixation. Under satisfactory general anesthesia, the fracture was manipulated. So this is the very important keyword here while coding this. And CM images were checked. The left upper extremity was prepped and draped in the usual sterile orthopedic patient. Two small incisions were made over the second metacarpal, and after removing the soft tissues, including tendinous structure out of the way, drawing was carried out and blunt tipped pins were placed for the EBA external fixation. So these incisions were not for surgery, just in order to put the external fixation system. So the frame was next placed onto the site for the proximal pins chosen. Small incision was made Subcutaneous tissues were carried out other way. The pin guide were placed in two holes were drilled. So these all the procedure done for external fixation system application. Means place fixation was assembled. So what happens here? After the application of fixation system, physician will check once again using the CM. As it is not open procedure, physician needs to take help from the CM or any other type of imaging guidance. So fracture reduction appeared to be anatomic. Suturing was carried out. This is very no need. So we will check 25600 first. So closure treatment of distal radial fracture or epiphyseal separation includes closure treatment of fracture of ulnar styloid when performed without manipulation. So that is wrong. So based on our question, physician has performed manipulated. See here, we have the keyword here, manipulation. So 25600 is wrong. We will check 25606 now. So 25606 is percutaneous skeletal fixation of distal radius fracture or epiphyseal separation. So but based on our question, physician has manipulated the fracture, but in 25606 there is no word related to manipulation. So 25606 is also wrong. So we will check 25607. So what is 25607? Open treatment of. So it is not open treatment. So it is reduction only. So 25607 is also wrong. So we are left with 25605, which is closure treatment of distal radial fracture or epiphyseal separation includes closure treatment of fracture of ulnar styloid when performed with manipulation. Using our keyword, we need to find the answer. So here, if you see here, 25605 is for with manipulation. So we need to code 25605 as the code. And what next? What is the other code? 20690 for external fixation system. So all this rationale with this we will go here, we are going to decide or finalize B is the correct answer. So go ahead and try for question number 7. So I hope everyone is able to understand this session. So it is also very easy. You guys can do it very easily. So next week we are going to post best tips to find medical coding job in Australia. So anyone planning to go Australia, you can watch that session. So we'll discuss the answer at 10:42. And also encourage your friends who are planning to learn free medical coding. Ask them to watch our sessions. So we are not taking any free for these services. So we will discuss the answer now. So the patient is a 36-year-old male who presents with Dupuytren disease. So what happened to this? So Dupuytren disease in right palm and ring finger. This results in, so using this is one important keyword. I think you can find the answer using this keyword also in the right palm and right finger. So these are the location of the disease. So you need to identify these as a very important keywords. So this results in contracture of the right ring digit MP joint. She is having subtotal palmar fasciectomy for Dupuytren disease, right ring digit and palm. So this is very important to understand. So an extensile bar Brunner incision was then made beginning in the proximal palm and extending to the right finger PAP release. PAP crease means proximal interphalangeal joint. So this exposed a large pretendinous cord arising from the palmar fascia extending distally over the flexor tendons of the ring finger. So basically physician is performing procedure on the ring finger. So we need to remember this. The facial attachments to the flexor tendon sheath were released at the level of the metacarpophalangeal crease. So we can mark it as a keyword, and one band arose from the central pretendinous cord, one coursing toward the middle finger. The distal nerve was identified and this diseased fascia was also excised. So basically here physician has excised the digital nerve here. See here, digital nerve identified and this diseased fascia was also excised. So remove the fascia here. So first we'll directly go and try to find the answer using the Dupuytren. I think we can find that. See here. So as I told, we can find the CPT code using the condition also. So we will check how many 2-bit 26040. See, this is also 26341. So this is not injection. So we will check our options now. So what are our options here? We will check 26035 first. 26035. So decompression, fingers and our hand, injection injury. So this is wrong. So directly we can eliminate 26035, 26040, then fasciectomy, palmar. This is percutaneous procedure. So, but here it is a open, open procedure. Incision was then made, beginning in the proximal palm. So we can eliminate 26040 also now. So we are left with 26121. So what is 26121? So fasciectomy, palm only, with or without jetplasty, other local tissue rearrangement or skin grafting, which is not occurred in our question. So we can eliminate 26121. We are left with 26123 and 26125. We will check those. 26123. Yeah, here only. So fasciectomy, partial palma with release of single digit including proximal interphalangeal with or without jetplasty, other local tissue arrangement or skin grafting. So we can code 26123, as well as for other finger each additional digit we need to code 26125. So based on this, physician has performed procedure on 2 digits. So we need to code here 26123 and 26125. Okay guys, F7 is for modifier, ring finger modifier. So now this is question number 8. Just check this question and find the answer. So first try to find the keywords. Then if you find the proper keywords and laterality, you can code it properly. So whenever you code musculoskeletal system procedures, you need to check whether it is a open procedure, closed procedure, percutaneous procedure, or arthroscopic procedure. So these are the keywords you need to find while coding musculoskeletal procedures. So try to find the keywords first, then you can code the case easily. Yeah, good Paramila. So what happens, Paramila? You are doing good here. So, but in CPC exam, you may not find the same questions. So, but these keywords and how we are eliminating the answers, you need to remember. So, as I told you before, you need to identify whether physician is performing as, like in musculoskeletal system, whether physician is performing open procedure, closed procedures, percutaneous skeletal fixation, or arthroscopy. So you need to find that keyword first, then you need to find what you call, then you need to find laterality. So we have 2 more minutes. So before 11:15, we'll conclude this session. Yeah, correct, Parmila. So F7 is the right middle finger. So we'll check one more time. So, but where is the procedure performed here? Ring finger. So you can take it as F8 here. So you can make it as F8. So F8 is the ring finger. F9 is the small finger. Is that fine, Parmila? Five, six, seven, eight. Yeah, correct. F8 is correct. Yeah, ring finger is F8. So we will discuss question number 8 now. So this is a 22-year-old female who presents today with sacroiliitis. So whenever you see the condition, you need to understand the condition. So sacroiliitis means itis means inflammation. So sacroiliitis means inflammation of sacroiliac joint. So on the physical exam, there was pain and palpation of the left and right sacroiliac joint. So this is the medical necessity for this procedure, and fluoroscopic guidance was done for the needle positioning. Then 80 milligrams of depomedrol and 1 ml of bupivacaine at 0.5% was injected into the left and right sacroiliac joint with 22 gauge needle. The patient was able to walk from the exam room. Okay, so basically here what happened? Patient has inflammation of sacroiliac joint and he is having severe pain here. So in order to reduce the pain, physician is performing injection of steroids. So here depomedrol and bupivacaine. So physician is injected. So we need to find the answer for this. So we will check 20611 first. 20611. So, so what is this? 20611. Arthrocentesis, aspiration, under injection, major joint or bursa, shoulder, hip, knee, subacromial bursa with ultrasound guidance with place permanent recording and reporting. But based on our question, physician did not use any ultrasound guidance. So here physician has used, what is that? Fluoroscopic guidance. So directly we can mark A is the wrong answer. So we will check 27096 now. So here injection procedure for sacroiliac joint. So here our location of the injection procedure is correct. Anesthetic or steroids. So as I told you, physician may use steroids in order to reduce the pain control with image guidance, fluoroscopy or CT, including arthrography when performed. Arthrography means it is like recording of the joint. So here this is half of the answer is correct here. So basically what happens in year B, we have 77012 is also there, but based on this guideline 27096 includes fluoroscopy. So here we no need to code fluoroscopy. So here 77012 is not required. So B is wrong answer. We can't code 27096, and D is also wrong answer. Why means 27096 defaultly includes fluoroscopic guidance. But if you check B and D, both are having 77012. So B and D both are wrong. A is already wrong. So we are left with 27096. If you check here, so 27096 is a unilateral procedure. For bilateral procedure, you use 50 modifier. So based on our description, physician injection was into the left and right sacroiliac joint. So because of this rationale, our answer is 27096. So while coding these injection procedures and breast biopsy procedures, this guidance is very important. Why means few codes defaultly includes fluoroscopy, ultrasound, and MRAs. So you need to check properly in order to code properly. So go ahead and try for question number 9. So I will reduce it for you. I think now you can see. So now it is 10:57. We will discuss the answer at 10:52. Sorry, 11:52. 11:02. Sorry. We will discuss the answer at 11:02. So here you need to find CPT as well as ICD. First check the CPT codes. Yeah, good Raju. Good job. So it is very easy basically. So best of luck for the people who are going to write CPC exam coming week. So we are hoping for the best. So don't get nervous while writing the exam. So you have 2 more minutes, but most of the people are writing this answer correctly. I think we no need to discuss more about this. So yesterday we have published integumentary system coding. If any one of you missed that session, just watch that session today and complete during this week whenever you are free. So personally, I love like this one. What do you call musculoskeletal system? Yeah, no worries, guys. So most of the people are right, correct answers only. So we will discuss the answer. So post-operative diagnosis: medial meniscal tear and extensive synovitis with an impingement medial synovial plica right knee. So these are the keywords here. So what is the procedure? Diagnostic operative arthroscopy, partial medial meniscectomy and synovectomy right knee. So the patient was brought to the operating place in supine position, after which he underwent general anesthesia. So as I told you before, we need to check the laterality in description of the procedure also. So the right knee, based on the heading of the procedure, operative procedure, right knee is the correct. Then prepped and draped in the usual sterile fashion. The arthroscope was, so you need to understand that this is a arthroscopic procedure. Introduced to anterolateral portal, interim portal created anteromedially. The suprapatellar pouch was inspected. The findings on the patella and the femoral groove were noted as above. An intra-articular shaver was introduced to debride the loose fibrillated articular cartilage from the medial patellar facet. The hypertrophic synovial scarring between the patella and the femoral groove was debrided. So this is also important keyword. The hypertrophic impinging medial synovial plica was resected. So we can consider it as also keyword. The synovial scarring overlying the intercondylar notch and lateral compartment was debrided. The medial compartment was inspected. An upbiting basket was introduced to resect the base of the degenerative posterior horn of the tear. So this is also keyword. This was removed with a grasper. The meniscus was then further contoured and balanced with an intra-articular shaver, reprobed and found to be stable. The cruciate ligaments were probed, palpated and found to be intact. So basically you need to understand whenever you see arthroscopy report is intact means those are good position. There is no problem with those. So you need to remember that keyword. Intact means there is no problem. They are in good position. So the lateral compartment was then inspected. The lateral meniscus was probed and found to be intact. So there is no problem with lateral compartment also. So the loose fibrillated articular cartilage along the lateral tibial plateau was debrided with intra-articular shaver. The knee joint was then thoroughly irrigated with the arthroscope. The arthroscope was then removed. Okay, fine. So basically, in order to find this answer, initially we need to check with 880 and 881. Based on this, we can eliminate two codes. 880. Oh, sorry. Typo error. So arthroscopy, knee. So this is arthroscopy. Fine. Knee surgical. Okay, fine. So what is 2980? So with meniscectomy, medial and lateral, but this is wrong. Why wrong? So based on our operative procedure, physician has mentioned lateral meniscus was probed and found to be intact. So physician did not perform meniscectomy on lateral meniscus. So 29800 is wrong. So 2980880 is for medial and lateral meniscectomy. But based on our question, only we need to physician perform procedure on medial meniscus. So 2980880 is wrong. So based on this, we can eliminate A and D. So we are left with two codes. So B and C almost correct. We are having only difference with M23221. We will find what is that. M23221. So M22221 for derangement of posterior horn of medial meniscus due to old tear or injury. We will check 211 also. What is 211? Derangement of anterior horn of medial meniscus due to old tear or injury. So, but based on our question, we have posterior horn derangement. So, because of that, our answer is M23221. So, I hope most of the people wrote correct for this. So, with this, we have completed today's session. So, our answer C 29881, this one. So, we will wait for few more minutes now. Now it is 11:07. So if we have any doubts, we will wait for 3 or 4 minutes. Then we will disconnect and we will meet in next session or next week. And encourage your friends to use our free resources in order to master in medical coding. So Parmala, surely I will consider your suggestion and try to make videos about those two. And meanwhile, you can send your concerns to that mail ID also so that I can remember. So what did you ask? Yeah, compliance and regulatory topic based also take classes. Sure, Parmila, we will try to make videos related to compliance and online procedures. So now it is 10:09. I will disconnect it. Sorry, 11:09. I will disconnect it 11:13. So meanwhile, if you have any doubt, please mention. In the chat box. So we can discuss those for few minutes. Compliance and regulatory and about exam method. Okay, no worries, Parmila. So anyway, you are having exam in July, na? So meanwhile, I will discuss with few people, those who are going to write in coming week. I will discuss with them and I will make one video related to that. So 22nd, one girl is going to write the exam. So 23rd, I will call her and I will make one video related to your concern. Yeah, sure. So any doubts here? Who are here? Parimala and Mamata. Are you here, Mamata? And Gaurav, Srinath, Pulin, Mohan, Chandu. So Manjur, Datta, seatmate, Deepin, Ojam, Bhim Reddy. So you asked about WhatsApp number, correct? Yeah, no worries, Parmila. Meanwhile, before your exam only, I will make one video. So now we are having only 2 minutes. 11:13, I will end this stream. And Parmila, if you have any material, please send to vincentmedicalcoder@gmail.com so that we can use this material for other people. Currently, what you are watching these sessions, materials provided by one of our student. Okay, next month, May. No problems. I will discuss with her 23rd or 24th. I will try to make one video. No worries. So video is enough, na? No need for live, na? I will make one video related to complaints. That's enough for you, na? So we have 2 more minutes. Okay, fine. So attend next week also, so that these sessions are very useful for you. Okay, thank you guys. Thanks for your valuable time. So help your other friends to attend these sessions. If they are unable to attend these sessions, ask them to watch our free videos. So thank you once more and have a good night, guys. We will meet you on next week. Bye, guys. Take care.